Hello, friends. The World Health Organization states that approximately 2 billion people worldwide suffer from iron deficiency. According to the WHO, iron deficiency is the most common nutritional deficiency globally. Women and young children are particularly affected. Since iron supplements are often sold without a prescription and are widely available, I would like to discuss this topic with you today. Let's begin with some theory. Why do we need iron? The primary role of iron in the body is that it is a component of hemoglobin. As you may remember, red blood cells, erythrocytes, contain hemoglobin, a protein whose function is to bind oxygen in the lungs and deliver it to tissues. This process enables tissue respiration, which is essential for life. Each hemoglobin molecule contains 4 iron atoms. However, oxygen transport is not iron's only function. Iron participates in many metabolic processes and plays a crucial role in immune system function. It is also essential for normal brain activity. Iron deficiency can impair cognitive function. In children, for example, it may negatively affect learning and development. Where do we obtain iron? Iron is found in both plant and animal products. It is present in grains, including bread, vegetables, fruits, leafy greens, and legumes. However, the highest amounts and the most bioavailable form are found in meat and fish. What does more bioavailable mean? Iron in animal products is present as heme iron, which is part of the hemoglobin molecule. It is found in tissues that contain blood, essentially in muscle tissue. When we eat meat, we consume heme iron, which is absorbed much more efficiently than non-heme iron from plant sources. When is iron especially important? There are specific life periods when iron needs are particularly high. The most important is pregnancy. During pregnancy, the developing fetus accumulates iron and obtains it from the mother. Therefore, iron deficiency in pregnant women is common. Ideally, one of the key steps in planning pregnancy should be ensuring adequate iron stores before conception. Entering pregnancy without sufficient iron often leads to supplementation needs later. Risk factors for iron deficiency include pregnancy, vegan or strictly vegetarian diets, low-calorie diets, and heavy or prolonged menstrual bleeding. If iron deficiency develops, it is often difficult to correct through diet alone. Therefore, it is important to monitor risk factors to prevent deficiency rather than reversing it later without treatment. Iron deficiency may lead to anemia. Common symptoms include pale skin, shortness of breath, dizziness, and fainting. It can also cause brittle or abnormal nails. Many people mistakenly assume nail problems indicate calcium deficiency, but often they are related to iron. However, these symptoms are not specific to iron deficiency alone. Therefore, it must always be confirmed through laboratory testing. The first test is a complete blood count, CBC, which measures hemoglobin levels. Anemia is diagnosed when levels are below 130 in men and 120 in women. However, hemoglobin can remain normal while iron stores are already depleted. This can be identified by measuring ferritin. Imagine you are in a small cabin during winter. The indoor temperature represents hemoglobin. If it is warm, everything seems fine, but the firewood represents ferritin. It is possible for the cabin to stay warm while the wood supply is nearly gone. Once the wood runs out, the temperature will drop. Ferritin shows the body's stored iron. If you have risk factors like a vegan diet or heavy bleeding, testing ferritin is strongly recommended. Always consult a physician with the results. Iron supplements are available in 2 main forms: ferrous, divalent, and ferric, trivalent. Ferric is typically for treatment under medical supervision. For prevention, ferrous iron is common. Iron sulfate is considered the gold standard due to extensive clinical evidence of its safety and effectiveness. Iron supplements may cause nausea, constipation, or abdominal pain. The severity of side effects is closely related to dosage. To take iron properly, start with a lower dose and gradually increase. Taking it between meals is best for absorption, though food can reduce side effects. Treatment typically lasts at least 1.5 to 3 months. Even after levels normalize, preventive supplementation may continue for another few months. With responsible management, iron deficiency can be effectively managed. Please share your experiences in the comments below. Health Today, signing off.